Good morning, everyone. My name is Preston Swan. I'm the Acting Chief Operating Officer for the Bermuda Hospitals Board and the VP for Clinical Operations at MWI. So welcome. And we're here today at the Child and Adolescent Services to launch and shine a light, really, on Children's Mental Health Awareness Month. And this is actually the first time that we are launching Children's Mental Health Awareness. I think it's very fitting. And we have the opportunity to welcome and introduce our Minister, the Honorable Kim Wilson, JP MP, Minister of Health, who will officially launch it. And we also have our clinical manager, Mrs. Fakita Bearsden, who will also, she's the clinical manager as well as a social worker who also provides some information. So I will welcome Minister of Health, Kim Wilson.
Thank you, Mr. Swan, and good morning, everyone. I'm so very pleased to be able to join you today as we launch the Children's Mental Health Awareness Month for Bermuda. There have been activities in May in previous years, but as Mr. Swan said, no formal moment has been conducted thus far to create space to focus on this, our most critical topic of mental health. The pandemic has changed the lives of many of us. There was an increase in concerns about mental health, and mental health awareness rose, not just in adults, but also in children. Now more than ever, we are aware of and concerned about our mental well-being and the state of our children's well-being. With this awareness and a better understanding of the issues, I hope that people concerned about their mental well-being seek help. So often there's a feeling of shame and concerns about being treated differently, but we must get past that. And as a community, we must do our best to not look at anyone negatively who has a mental illness. I believe in the resilience and the potential of our children and our adolescents, and the need for us as a community, as service providers and as government, to do all we can to help our young people. A report from UNICEF in October 2021 entitled "The State of the World's Children 2021, On My Mind, Promoting, Protecting, and Caring for Children's Mental Health" highlighted that more than 1 in 7 adolescents aged 10 to 19 is estimated to live with a diagnosed mental disorder globally. The report also stated that almost 46,000 adolescents die each year from suicide. Suicide is the 5th most prevalent cause of death within this age group. And the pandemic will not have made the situation easier for our young people. In Bermuda, our Child and Adolescent Services team has seen increased referrals for eating disorders and increases in social anxiety-related symptoms and adjustment disorders. Overall, admissions to the Child and Adolescent Services are rising significantly. 25 clients were admitted in 2019, and today in 2022, there have already been 39 admissions. But as always, there is hope, and the pandemic is only a part of our young people's experience. UNICEF stresses that having loving caregivers, safe school environments, and positive peer relationships can protect our children. Equally, however, exposure to violence or abuse, discrimination, poverty, and health emergencies such as COVID-19 can impact a child's mental health throughout their lifetime. The theme for this year's Children's Mental Health Awareness Month is Healing and Growing Together through APPS, with APPS standing for Awareness, Prioritizing, Prevention, and Support. It highlights that we can all assist our young people as families, communities, and service providers. We must improve our awareness of the needs of children who experience a mental health or emotional challenge. All of us, parents, grandparents, aunts, uncles, friends, and teachers, everyone who has contact with our young people. This means being alert to the changes in behaviors or moods, whether disruptive or withdrawn. Once we have improved our awareness, we can then move beyond understanding into acceptance and begin to dismantle the mental health stigma that leaves so many people suffering in silence. We need to prioritize meeting all of our children's mental and psychiatric health needs. About half of all mental health issues start by the age of 14, and this is not a predicament that only adults experience. We can make a huge difference by focusing on prevention and creating safe environments that nurture well-being and resilience at home, school, and in our community. Support is provided through funding, through accessible, effective services, and within the families and schools of our young people. This is very much in line with the Bermuda Health Strategy's core vision of healthy people and healthy communities. And just like physical illnesses, some mental illnesses can be prevented. And where they cannot be prevented, the protective factors of nurturing relationships and support will help our children to cope, manage, and reach their full potential. Awareness campaigns such as this one are very, very important. They help people understand and look after their mental health. And awareness and understanding can help to reduce the stigma. As adults, if we embrace the fact that mental illnesses are no different from common physical illnesses, then our children will also be far more comfortable discussing and sharing with us how they feel. The first step in reducing mental health stigma is providing accurate information about mental health disorders. And this can include sharing straightforward facts about certain issues, like the symptoms of depression or anxiety. And as parents, we can also help to dispel the myths about mental health to our children and provide them with help in understanding that mental health disorders are treatable. When parents frame mental health disorders as treatable conditions, children can feel far more comfortable about seeking treatment. And mental health is part of our overall health, and children know that they need to see a doctor when they have an illness or an injury. The same is true when they struggle with a mental health issue. Talking about mental health as part of their overall health helps to reduce and remove any shame or embarrassment. So with that, again, I am so delighted to be able to join you today as you launch Children's Mental Health Awareness Month for May. Thank you.
Good afternoon, everyone. We are so grateful to have this first launch for Children's Mental Health Awareness Month. As shared previously, we have done things in the month of May before. However, this is the first time we've actually taken a moment to stop and really prioritize our children, our adolescents, as we should. As the minister stated, this year's theme is helping and growing and healing together through apps. Apps standing for awareness, prioritization, prevention, and support. And that takes all of us, whether we are parents, teachers, mentors, it takes everyone. So it's our responsibility to ensure the success of our children, of our loved ones, every day. So once again, we thank you and appreciate your support as Child and Adolescent Services of Bermuda Hospitals Board launched their first Children's Mental Health Awareness Month. Thank you.
Are there any questions?
Yes, I have one question. I don't know who wants to answer it, but I just want to know, can you tell us more of recent concerns surrounding young children and young adults currently?
Of course, we know that COVID has dysregulated a lot of things for not only children, but as well as adults, very much impacting households and parents. But what we see here at Child and Adolescent Services, definitely the adjustments of going back to school after being out of school for so long. So just imagine a child who is getting ready for preschool or P1, but have been home in isolation and struggle now to take part in structure, sitting at a desk, as well as those who already may have had some challenges with socially being out and about. And now I've been inside in my comfort zone for 2 years, and you're requiring me to go back into a classroom setting. You're requiring me to get back into netball, etc. So those are the main challenges that we've seen, especially over the last 2 years, with social anxiety or anxieties in general. And if we want to classify it wholly, it would be considered a mood disorder, as well as those adjusting to the new, because it is a new for children as well as, I said, adults.
Okay, thank you.
I have a question. With regards to the launch of the month, as you're saying, it has, you have done activities before. Why has it taken until now to do an official launch? Why not in the past, and why now?
It's never not been a priority, but especially with looking at where the children and adolescent and the island in general is now is always the best time. And so we understood the impact that it would make for the community and the island So we're going to take the opportunity and move forward and make it an annual and a proclamation every year moving forward.
And with regards to the month, what are you going to be doing to raise the awareness?
Right, so some of the things we have reached out to the Department of Education as it relates for our younger children to have children's mental health awareness activity books that the guidance counselors can go through with their students during their guiding sessions. We're also going to have a children's mental health wellness fair here on our grounds at MWI. We're hoping for the middle and high school students, a certain number from each student, but we're just waiting for confirmation from the department. And on May the 26th as well, we're hoping that the island, in support of Children's Mental Health Awareness, would actually wear green on that day, which is the official color for Child Awareness Month for mental health.
And I guess just on that point, I would imagine you would say it's very important for everyone in the community, not just those directly affected by mental health issues, but everyone just to be aware and to be part of this.
Yes, and we're here for support at Child and Adolescent Services. Whether it's you have a question, a lot of people don't know what's the difference between is this appropriate for this age range, or is this something that I actually need some help on? Give us a call. That's what we're here for. So definitely.
Thank you very much.
Thank you.
Thank you. Can we actually get you together and I'll just take a quick photo?